Hi, my name is Dr. Gregory and I'm with the oncology team at Sick Children's Hospital. Having a child diagnosed with leukemia, which is a disease of the blood, can be a very trying time. This video aims to guide you through some of the psychological processes and treatment associated with that condition. You will also meet a survivor of leukemia who will tell you in his own words what it was like to experience this disease. It's important during this time that you get to know your child's oncology team. From the head of the team to the radiologist, from the nurses to the social worker, they will help connect you to the resources you need to provide your child with the psychological support they need while fighting this disease. I'd like to introduce you to my colleague, who will help you understand some of the processes your child will undergo.
Hello, my name is Dr. Fitzgerald, and I am a psychologist with the Sick Children's Hospital. During and after your child's treatment for leukemia, it is important that your child receives psychological support as well as their medical treatments. You may even find you need some support yourself. Your child may benefit from individual or group therapy to understand their illness and treatment. This will help them cope with the anxiety around this. Parents and sibling support groups are an excellent resource for your family. It is important that you keep your child's school updated so that your child can receive any accommodation during and after treatment. A psychologist such as myself will evaluate your child during and after treatment to ensure they are mentally healthy. I will do this by using tests to measure the level of anxiety, stress, depression, and quality of life. From this, a recommendation can be made for the best course of treatment. UC will help give some insight as to what it really is like to face an illness like this. Can you give us a brief overview of your experience with leukemia?
Hi, my name is UC Allanan. I was diagnosed with AML when I was 12 years old. I've been through chemotherapy. I've also had a bone marrow transplant.
Did you experience any fear or anxiety? How did you cope with that?
I went through a pretty traumatic experience when I was younger. One of my good friends died from cancer. Some of the things that it affected me by was that it could also happen to me. I also feared that it could come back, like my own cancer. Some of the side effects from chemotherapy were some heart problems, and I actually had to quit my job and go on ODSP because of it. Some of the ways that I dealt with it were my cancer camps, which kind of like a second family to me now. I also like to talk to my family about my cancer and stuff, as I find it really helps, and I also go through therapy as well.
Has this affected your schoolwork or ability to learn?
I actually missed a year of school. It's also affected my short-term memory quite a bit, and I also had to get an IEP through my schooling as well.
If you could give someone who is newly diagnosed one piece of advice, what would it be?
Go to the cancer camps, as they are kind of awesome, and also to get friends who understand cancer, as I find that really makes it a lot easier to cope with the cancer, and always remember that there is life after cancer.